Hi, my name's Wendy. I'm a registered nurse and I'm the injury prevention coordinator here at Kootenai Health. And today I'm going to take you through some fall prevention exercises as part of our balance and fitness class. So what you'll need for the next 20 minutes here is you're going to need a sturdy chair. If you have some sort of stretchy band and a water bottle nearby, and we'll go ahead and get started. So the first thing we're going to do is we're going to march in place. We're going to get the blood flowing to our body, get things moving, making sure that you have good sturdy shoes to wear. Also want to remind everybody before you begin an exercise program, make sure that it's okay with your doctor or your primary care doctor. So we're marching in place, getting those arms moving, getting the blood flowing to all of our major muscle groups here. Again, having good sturdy shoes, a nice area that is flat and clean of any kind of obstacles. And while I'm marching in place here, I'm going to look over my left shoulder, just kind of stretching out those muscles on the side, nice and easy. Remembering to breathe. Coming back to center. At any point, if you need to sit down and take a break, please do. And don't forget, anytime you want to take a sip of that water, you're more than welcome to. You listen to your body. Looking over my right shoulder now. Again, marching in place, just getting that blood flowing and moving. Coming back to center. And we're going to do that left side again. So let's get ready. Here we go over the left side. Getting a nice little stretch out of that neck. Remembering to breathe the whole time. Back to center. One more time over our right shoulder. Here we go, over to the right side. All right, I'm still marching in place, getting that blood pumping. My heart's going. I'm going to do some shoulder circles here. Putting my arms up on my shoulders. Still marching in place. If you need to sit down, you can do this exercise while you're sitting. While you're sitting in your chair, you'll just tap your feet and roll those shoulders. Going to do the opposite direction now. Again, really working on getting blood moving through to all these muscle groups, circulating throughout our body. Going to bring those arms down. I'm still marching. Going to roll my shoulders forward. So both shoulders in the forward direction. Doing great. Again, listen to your body, your breathing. If you're feeling too much pains or aches or short of breath, sit down. All right, you guys are doing great. Going to do those shoulders backwards, the opposite direction now. Again, this is part of our warm-up here, getting going, rolling those shoulders backwards. And now we're going to tap our knees. This is our last exercise in our little warm-up section here. So I'm just holding my hands out, tapping my knees. Again, if you need to sit down, you can do this exercise sitting in your chair. Make sure you're towards the edge of your chair and not putting strain on your lower back. You're doing good. We're going to do this about 30 more seconds, and then we'll take a little water break. Doing good. Getting those feet up off the ground. Picking a fixed point straight in front of me. 5 more seconds, you're doing good. In 3, 2, and 1. Very good. Grab that chair, grab that sip of water too. Next up, we're going to do some band exercises. Grab a quick sip of water here. So again, when I'm sitting in my chair, want to make sure my chair is nice and sturdy. What I don't want to have is an office chair that's on wheels and it's going to wheel out from underneath me. So make sure you got a good steady chair, practicing nice straight back, good back alignment. And I'm going to take my band. Quick key points on bands I want to point out real quick before we get started. Bands come in different colors, and the different colors are an indication of their resistance. Yellow tends to be really easy, Black ones tend to be really hard. Blue and green are right in between, and they're probably the most common ones. When we use bands, we also want to make sure we keep our wrists straight, and we also don't want to pull back on our thumb and cause any kind of overextension of our thumb and injury. Keep that in mind. Last thing, don't wrap them so tight around your hands that you cut off the circulation. All right, so I've got my band. I'm sitting nice and tall and straight. I'm gonna just do some simple horizontal exercises. Just pulling it right out, got my arms out in front of me. And just doing some nice resistance as that band comes back. I'm using that resistance. And we're gonna keep doing this about 30 seconds here. Again, remembering to breathe. Inhale as we go, exhale as we exert. And just kind of keeping that nice and smooth, really working up into the shoulders areas, the back of our upper part of our backs. Nice and smooth. Again, you can put your hands closer together for more resistance. Walk your hands out for a little less resistance. Doing good. We're going to do this about 10 more seconds. And then we're going to switch in 5, 4, 3, 2, and 1. Little break. Shake out those arms. At home, as you do these exercises, usually about 5 seconds in between exercises allows your muscles to get enough oxygen and blood back into them. All right, for our next exercise, we're gonna take the band and we're gonna do some chest presses. I bring that band right up behind my shoulder blades, nice and high. Again, making sure I don't wrap that band around my wrist too many times or that I'm putting too much weight and strain on my thumbs. With my arms, I'm gonna reach straight out in front, keeping those wrists nice and straight. We're just gonna alternate our arms. Making sure you breathe in between. Deep breath in. Exhale as we exert. Very good, doing great. Keeping those arms right in front of me. As I'm sitting here, I'm picking a nice fixed spot on the wall. I'm also trying to pull my belly button back towards my spine, really engaging those abdominal muscles. Sitting nice and straight, practicing good posture. Keep going, you're doing good. Don't forget to breathe. About 10 more seconds here. Doing great. Again, that full extension, using that resistance as part of my exercise as it comes back. In 5, 4, 3, 2, and 1. Very good. Take a little break. Using that band, we're going to do some bicep curls. So with this one, I'm going to put it right underneath my foot here. So on my right foot, and I've got it just under the ball here. Sitting straight, we're going to pull straight up towards us, right towards our chest. The key here is keeping those elbows nice and close to the body. And again, really engaging that core. Think about pulling that belly button back towards the spine. And here we go. We're doing bicep curls under and I've got that band right underneath my right foot. As that resistance comes down, use that resistance. Don't let it just snap back. And you're doing great. Now you can go by reps if you prefer, or you can go by time. I tend to do a lot more of my exercises that are time-based, usually in 30-second to 1-minute intervals with a 5-second break in between. But you do what's comfortable for you. 10 more seconds here, keeping that belly button pulled back towards the spine, engaging those abdominal muscles. And here we go in 5, 4, 3, 2, and 1. Very good. Shake that out. Give those arms a little break. We're going to switch over to the left foot now. So again, finding that spot right there underneath the ball of my foot. And at any point you need to stop and readjust, please do. Sitting up tall. And here we go for our next 30-second reps here. Now these are things you can do at home too if you're just watching TV or binging your favorite Netflix, giving yourself a little bit of exercise. and keeping that strength up as well. Elbows are staying nice and close to my body. Still remembering to breathe. And again, working with that resistance. If it's too easy, walk your hands down a little bit so that your band's a little shorter. That'll give you a little bit more resistance. If it's too easy, walk your hands down. Too hard, walk your hands up. Doing good. Got about 5 more seconds. And 3, 2, and 1. Very good. All right, shake out those arms. We're going to give those arms a little break and work on our legs. We're going to do some toe extensions. Grab a sip of water if you need to. Again, at any point, listen to your body. You need to stop. You need to take a break, a sip of water by all means. All right, so this one on the toe extensions, 2 different ways you can do this. You can either do it with your leg up off the ground and extend those toes forward, or you can keep your heel on the ground and your toe going forward. One thing to know when we're sitting in our chair doing exercises, we only pick up one leg at a time. We don't do both legs at the same time. That can put a lot of strain on our lower back. So keep that in mind, one leg at a time off the ground. All right, so sitting nice and high. We're going to continue. Do some toe flexes. We're working all those tendons and ligaments, muscles that are around our ankles. So flexing those forward. Again, if you want to bring your leg up and extend, you're more than welcome to. Just doing the toe and ankle there. We're going to do some full leg exercise resistance here in just a little bit. So again, toes moving forward, doing great. Using that resistance as it comes back. And we've got about 10 more seconds. Trying to keep that knee and that ankle in alignment. And again, off the ground or on the ground, you do what's most comfortable for you. Keep that posture in 5, 4, 3, 2, and 1. Very good. Let's switch legs. Shake out that leg, and here we go. Doing my left leg now. Got the band right underneath the ball of my foot. And we're again just going to roll that ankle forward nice and easy. Think about strengthening those ligaments and tendons that are engaging everything. If your leg's too tired, you can put that heel on the ground, and again, just pushing forward like you're pushing the gas pedal. Doing great, about 15 more seconds. And remembering to stay nice and straight, good posture, no slouching. In 5, 4, 3, 2, and 1. Very good. We're going to switch over to our other foot now. This time we're going to do those full leg extensions. Couple key points here. Want to really keep my hip, my knee, and my ankle all in an alignment as it comes straight through. We don't want things deviating and putting too much strain on the knee. So again, if I want more resistance, I'm walking my hands down. Less resistance, I'm bringing them back. I'm going to start with that right leg. And here we go, pushing all the way through and coming back. Doing great. I'm going to do this for about 30 seconds. Picking that fixed point on the wall straight in front of me. Really being mindful of keeping things in an alignment. Again, it's hard as that resistance when you come back up. All the way through, extending that leg. Full extension, engaging everything there. You should feel this all the way through, from your hip to your quads, all the way through into your lower calf. Be mindful of your knee. If this is causing a lot of knee pain, then back off. 5 more seconds, and 3, 2, 1. Very good. Shake out that leg. Take a water break at any point. This is our last one here in our band exercises. We'll be moving on to mobility and balance next. All right, left leg. Nice and straight, belly button towards the spine. Here we go. And pushing that leg all the way through. Doing good, keeping that hip, that knee, and that ankle in alignment. When you feel good with that motion, look up and pick a fixed point on the wall ahead of you. Try to do it without looking at your foot. Nice and smooth. Doing great, about 10 more seconds. Remember to breathe, exhaling there on the extension. In 5, 4, 3, 2, and 1. Great job. Take a sip of water. You can set that band off to the side. And we'll be moving on to our balance and our mobility section. So for this next part, for our balance and mobility section, have that chair nearby. You always want to have something to grab that's nice and sturdy, just in case. Again, put your water where it's best for you. I just set it on the ground, but if you need to set it on a chair nearby, that works out as well. All right, so for this next one, we're going to work on a little bit of footwork. We find that in a lot of fall prevention, having good steady feet under you really, really helps in preventing you in falling. So box steps. I have an imaginary box right in front of me, like a rectangle. I'm going to stand over into the far left side of the box. I'm going to lead up 1, over 1, back 1, and then back to where I started. The first couple times you do this, you may need to look at your feet. The object is to look up. Pick a point on the wall so that you can do this without looking. So we're stepping forward, going over, 1 back, over and around. We see a lot of folks at home here at the hospital that come in with broken hips as a result of tripping over things. A lot of times little dogs, little critters that love us so much, they get right under our feet. People trip over those and fall as a result. This is a great exercise. And pretending like you're doing your fancy footwork so you don't step on anything. All right, back to that left corner. That's where we started. Now we're going to slide over to the right corner of our box. Going to do the opposite direction. We're going to go ahead and step forward, over, back, and to the side. If this is too boring and ordinary for you, lift up those feet a little bit like you were stepping over the dog. Don't step on the Pomeranian. There you go, over to the side and back, over 1. Again, I've got my chair fairly nearby in case I need to grab something or I need to sit down. I'm gonna do this again. I'm at the top, over to the left, back 1, to the side, trying to bring those feet all the way back together, and I'm trying not to look at them. I'm picking a fixed point on the wall right in front of me. And over, we're gonna do this, coming back around 1 more time. Here we go. Over to the side, back, and back to 1. All right, so we're back in our center here. Still working on that footwork. I've got my chair here. At any point, if you want to sit down, you can do this also while you're sitting in your chair. We're just doing some heel work here. So it's kind of the little over to my heels and just coming right back. Put your hands on your hips or down to your side, wherever it's more comfortable. We're going to make this a little bit trickier. Again, just working on those feet, getting that feet up and over. This is kind of avoiding that stumbling sometimes that we do. All right, we're going to tie this in and we're going to move to the left now as we do this. There we go. Very good. And we're just kind of worming our way over to the left, and then we're going to come on back over to the right. Doing great. Again, just getting used to having those feet in different areas, working those muscles and tendons to keep our ankles strong. Very good. Keep going, about 15 more seconds on these. Very good on the heel taps. All right, let's come on back to center. in 5, 4, 3, 2, and 1. Very good. We're going to step to the side. 2 more exercises here in this balance and mobility section. These ones pretty straightforward. Again, the idea is trying not to look at my toes. So I'm just going side to side here, over to the side. We're going to throw a reach in here in just a second. Go as slow or as quick as you need, but the idea is not to tangle up your feet. Bring them together and apart. Together and apart. I'm just moving from center to right, back to center, and to left. We're going to throw in a little reach here as we come back to center in just about 5 seconds. All right, come on back to center now. And then we're going to do our opposite hand and our opposite foot, kind of like the John Travolta almost. Listen to those shoulders. If your shoulders are not able to go up over your head, don't push it. One thing to note too, when we raise our arms up, we want to make sure that palm stays down. It's just a little bit better posture and a little easier on our shoulders. We don't want to cause any kind of damage. Again, I'm picking a fixed point right out in front of me. Getting those arms up. Doing good. About 15 more seconds, and then we're going to take a break, move on to our next section. You guys are doing fabulous. Getting those toes really stretched out. In 5, 4, 3, 2, and 1. Very good. Take a sip of water. Step out those feet if you need to. Have a seat too if you want. We're going to stay standing, but again, all these exercises you can do sitting as well. Next one here, we're going to kind of work on our balance and strength. This is our last kind of big strenuous part before we start cooling down. So what we're going to do with this one is we're going to pretend like we're going to roll an imaginary ball. Now for these next set of exercises, we're really going to be using a lot of our lower body. Again, if you need to sit down, please do use your chair for those exercises. This one here, I'm picking up my right foot and I'm just rolling that imaginary soccer ball. If you can do it without grabbing your chair, by all means, doing good. This one's really important to pick a good fixed location straight out in front of me here. So I've got my eyes on a spot on the wall behind the camera there. Doing good. 15 more seconds, grab that chair if you need to. We're really working those quads. If you need to sit, you can do this exercise sitting again. Rule of thumb, just 1 foot at a time off the ground. And 3, 2, and 1. Very good. Give that leg a little rest. About 5 seconds. We're going to do the opposite leg now. So again, standing, I've got my good shoes. I'm nicely planted into the ground. Back is straight, heads up, eyes up. And here we go, that imaginary ball with the left foot. Doing great. Again, if you feel good, taking your hand off the chair by all means. And you put this other hand wherever it's comfortable. Going to do this about 20 more seconds. Oh, it's tricky. Have that chair ready. Don't forget to breathe. Doing good. About 5 more seconds here. And 3, 2, and 1. Very good. Give that leg a rest. All right, we're going to do some knee circles next. Again, we're really working these quads, these hips, things that we want to do to build our strength when we trip or stumble to keep us from falling. Again, this one you can do sitting down or standing up, and make sure you have that chair nearby. So taking that knee, and I'm just doing counterclockwise circles, just like so. If you feel good, again, take both hands off, put them on your hips. You can hover them or hold on to that chair. You do what's comfortable for you. Any point you want to sit down, please do. Take a sip of water. Listen to your body. A little sore is good. Any kind of pain, sit down right away. Got about 10 more seconds. Feel those legs really warming up. In 5, 4, 3, 2, and 1. Very good. Shake that leg out. It worked hard. All right, same thing. Got to get that left side. Have that chair ready. And here we go. Almost 5 seconds. Again, 5 seconds in between as best we can. And then now our left leg. We're just doing kind of gentle circles. I'm going clockwise right now. In 15 seconds, I'm going to switch and do counterclockwise. Staying as nice and straight, keeping that spine straight all the way through. And then we're going to get ready. Now I'm going counterclockwise. 15 more seconds. Doing wonderful. Don't forget to breathe. Doing good. About 5 more seconds. And 3, 2, and 1. Very good. Stomp those legs out. All right, we got 2 more, and then we're all done, and we'll start cooling down. Next ones are called donkey kicks. You can do a variation of this sitting kind of on the edge of your chair if you need to. What I'm going to do, I'm going to show you from the side. So I'm going to bring that leg up, and I'm going to kick it straight out. Be really mindful of your back on these exercises. I want to try to stay as straight as possible. I don't want to cause strain on that lower lumbar section at all. Again, if any of these exercises are contraindicated by your surgeon or by your physician, please do what they're telling you to do. All right, so right leg's coming up, kicking right back. We're doing this for 15 seconds on both legs. Doing great, staying really nice and straight. Straight behind me as I can feel it really engaging all those glute muscles as well. Doing wonderful. 3, 2, and 1. Very good. Shake out that leg. Got to do the left leg now. Bring that chair around. Same thing, my back is nice and straight. Got a fixed point on the wall ahead of me. Leg comes up and straight back. Again, trying to keep that back as straight as possible. Really extending out that leg, feeling that stretch all the way through my hip flexors and through my glutes as well. And you're doing good. We're just doing short ones on these donkey kicks. 5 more seconds. And 3, 2, and 1. Very good. All right, last ones. We're going out with a bang, and then we're all done with our strength. We'll go into our cool down exercises. Next one we're going to be doing is squats. And do this one standing. Have your chair behind you in case you need to sit down. Now, if you are sitting, you can do a variation that's just the sit stand. Got my feet barely out in front of me so that I'm not over my knees, and I can just go from a sitting to a standing position. For the squats today, I'm going to stand about shoulder width apart. Arms are out in front. Again, keeping that back as straight as I can. Do this for 30 seconds. Again, this is our last hard exercise that we're going to be doing. And here we go. All the way down, coming up. Being mindful that my knees are not going over the front of my toes. I'm going to turn just so you can see a little better. Keeping my back as straight as I can. And really engaging those hip and those quad muscles. Doing good. We're about 10 seconds in. 20 more to go. Keeping my back nice and straight. Really trying to put all the weight here into my quads, glutes. Doing good. About 5 more seconds. And 3, 2, 1. Great job. You did wonderful. Have a seat. Grab that water. We're just going to finish out with a few little cool down exercises here. So again, you can sit down or stand up, your choice. I'm gonna grab my pant leg and stretch out this lower leg. If you want to stand, you're more than welcome to. Just kind of staying nice and straight. And I'm just doing a gentle stretch. What I don't want to do is this really arching that puts too much strain on my knee. So I'm just grabbing my pant leg and just holding it, just like so. If you are tired and need to sit, you can do it on the edge of your chair and grab your pant leg just like this as well. Your choice. So holding that, just really working on my breathing. Again, we're in the cool down section now. Hold this about 5 more seconds, and then we're gonna switch. 3, 2, and 1. Go ahead and switch legs. Again, sitting or standing, you do what's comfortable for you. Keeping that back straight. Again, not putting too much strain on my knee. All these exercises are just designed to kind of help supplement and help you from falling. If anybody is doing physical therapy, listen to your physical therapist. These were not meant to take place of physical therapy. So again, listen to what your physical therapist is working with you on and be mindful of the exercises that are appropriate for you. All right. Grab a seat. We're gonna go ahead and stretch out those arms. I've got my right arms just coming straight across my body here. And I'm just gently holding it. I'm not pulling it. I'm just kind of supporting it here. Anybody that's had any kind of rotator cuff surgery, shoulder surgery, be mindful of the range of motion exercises here. Any kind of sharp pain, stop immediately. But right now, we're just giving it a nice little stretch. Hold that for just a few seconds. And 3, 2, 1, we're gonna switch arms. Left arm up. Again, just nice and gentle. I'm not pulling it, I'm just supporting it, allowing those tendons, these muscles around here to just get a gentle stretch after working them so hard. You can also just support your arm if you need to. And hold it 5 more seconds. 3, 2, 1. Go ahead and shake those arms out. We're going to do the behind your back stretch. These ones here, this is just where we're trying to reach and get our 2 arms together here. So I'm just doing a nice gentle reach. Frequently you're able to do one side more than the other. Again, listen to those shoulders. If this is an exercise you can't do, don't do that one. And I'm still remembering to breathe, keeping a nice straight back. And we're holding it. 5, 4, 3, 2, 1. Switch arms. Opposite side. This is the side I can't reach as well. So usually I have one side you can do really good and one not so much. This is my not so much. And just kind of holding that. Again, working on my breathing. Allowing all that oxygen to get into all the muscles that I worked today. Hold that 5 more seconds. And 3, 2, 1. Very good. Just doing some little wrist circles. This is our last of our cool down. We'll do a couple deep breathing exercises afterwards. You can hold them if that's too much work on your shoulders, your choice. And switch directions. We want to do both directions for our range of motion. Again, hold those wrists if you need to. You can do them like so, or both at the same time, your choice. And about 5 more seconds here. 3, 2, 1. Very good. Shake out those arms. So to kind of conclude our exercises we've done today, we're going to do some deep breathing exercises. Deep breathing is always good. Really helps fill up our lungs, gets all the way down to those little alveoli and helps them expand. But it's just also good for our peace of mind as well. All right, so put your hands where they're comfortable. I'm just going to rest them right here in my lap. Still keeping really nice posture. My spine is nice and straight. and I'm gonna pull in as much air as I can. In hospital terms, we always call this in the medical world, pulling in great tidal volumes. So filling up those lungs as much as you can, and then you're gonna hold it just for a moment, and then nice and easy, slowly exhale. Think about squeezing out all that residual air, getting all the way down to the bases of our lungs. Very good. We're going to do this 2 more times. Deep breath in as much as you can. Hold it just for a second. And slowly exhale, allowing all that air to come out nice and easy. And 1 more, last one here. Deep breath in. And nice and easy. And exhale. Being mindful of our breathing, letting all the stress of the day come out as well. Great exercises to practice wherever you are. Well, that concludes our balance and fitness, some of our fall prevention exercises. We offer our WebEx class every Monday from 1 to 2 p.m. Medical clearance and assigned consent is required prior to participating, and we can work with you on getting those forms. We'll also send you those exercise bands so you can practice those at home. For more information on our fall prevention classes, you can visit our website at the hospital at kh.org. You're also welcome to email us directly, trauma@kh.org. All right, well, thanks again, and have a great day, everybody.